Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
of pathophysiology of endometriosis. The most accepted theory for endometriosis is Sampson theory. Sampson theory of implantation or Sampson theory of retrograde menstruation. According to the Sampson theory, the endometrial cells will undergo reflex and they are resistant to apoptosis, and these reflexed endometrial cells are responsible for they will induce the inflammation and immunological changes. But this theory does not explain the occurrence of endometriosis in premenarchal females or females with Mullerian agenesis or in pleura, lungs, and umbilicus, but it can explain why ovary and pouch of Douglas are the most common, ovary being the most common and pouch of Douglas being the second most common sites. Why are they the most common sites is expressed by uh, Sampson's theory of implantation or retrograde menstruation. According to it, whenever the patient menstruates, some of the blood goes instead of going from the uterus out into the cervix and vagina, the blood may go into the fallopian tubes and ovaries, and these endometrial cells uh, will not undergo apoptosis, and these reflexed endometrial cells will induce inflammation and immunological changes resulting in endometriosis. Next, endometriosis at the umbilicus is explained by a theory called as lymphatic theory, which is given by Halban. It is also called as Halban theory. So Halban theory gives us about the endometriosis at the umbilicus. Then coelomic metaplasia theory. Coelomic metaplasia theory is given by Ferguson, Halban, and Ivanovs. According to Ferguson, Halban, and Ivanovs' coelomic metaplasia theory, mesothelial cells derived from the coelomic epithelium are present at various sites, and these mesothelial cells undergo metaplasia. So, this explains why there is endometriosis in the lungs, pleural cavity, or in the prepubertal females or in Mullerian agenesis. Because in all these sites, the mesothelial cells which are seen, they will undergo metaplasia. Genetic factors of endometriosis. Genetic factors of endometriosis include KRAS gene plays an important role. Endometriosis is 6 to 7 times more prevalent in first degree relatives. Immunological factors. Endometriosis is associated with cellular and humoral immunity. Impaired immune function may contribute to the endometriosis. Then, hormonal theory. According to hormonal theory, whenever there is excess estrogen present or if there is altered estrogen metabolism, that is in hyperestrogenic state, endometriosis is most common. Increased prostaglandins like prostaglandin E2 results in inflammation, and prostaglandin F2 alpha causes vasoconstriction and myometrial contraction, and these will result in dysmenorrhea. Endometriosis is like a chronic inflammatory condition. Progesterone acts as an anti-inflammatory agent. The level of progesterone also decreases. Then, in endometriosis, anti-nuclear antigen is seen. So, these anti-nuclear antigens are derived against the these anti-nuclear antigens are directed against the endometrial antigens like transferrin and laminin 1. Whenever endometriosis is seen in pubertal females, we should always rule out Mullerian malformation.
rule out Mullerian malformations like Mullerian agenesis or some other malformations should be ruled out.
Thank you and thank you for watching.